And we're back with our guest, the Honourable Peter Bethlenfalvy. He is Ontario's Minister of Finance. Peter, you talked a lot in the first couple segments about the emphasis on infrastructure investment in this year's budget. What specific projects do you see as really important to the future economic vitality of the province?
Well, I think, we have to focus on economic prosperity, and what that means, what provincial governments can do is, think about if you have 1 million population growth in the last 2 years that we've had, and that's going to continue. Where are they going to go to school? Yep. We have to build the schools. So we've got a $16 billion plan to build schools in Ontario. How are they going to drive to get the kids to school? Many places you can't take public transit. Ontario and Canada is a massive geography. So, making sure that we got the highways, the Highway 413. So we've really leaned into that. And after fighting the feds for a couple of years, they finally relented, saw the light, and now they're working with us to get the Highway 413 built, which is going to help move people and goods in part of the province. Building the subways. We've got 4 subway lines drilling, subway tunnels right now as we speak. That's unprecedented. And you know what? That's going to allow to take cars off the road and actually free up gridlock so we can move even more people. That's good for the environment. So things like that we just have to continue to do on the infrastructure side. With a growing and aging population, Tony, you have to have the healthcare system in place, not just hospitals and long-term care homes, but also home and community care. Putting in the infrastructure to make sure that we can take care of people and we can take care of them where they want and need to be taken care of, and often that's at home. So it's a bit of a transformation on the infrastructure side. It's unprecedented, I think, in the history of Ontario, maybe even Canada. And in North America, we've got more cranes on the skylines in Ontario, right across the province than we've ever had. So we're leaning into making sure we build the economy and making sure we make the investments that take time to get done, but a relentless approach to getting it done.
I'm glad you mentioned healthcare, of course, because that's top of mind for Ontario residents as well. You mentioned some of the infrastructure spending there. In terms of operating money as well, was that a focus of your budget?
Absolutely. So let's take healthcare, for example. I'm glad you mentioned that. We really leaned in on investing in primary care, so right. More family doctors, and we've done that in many different ways, but what we call interprofessional teams in the communities, so that you get more care locally in the community. We invested, and that will onboard another 600,000 patients in the province. We put more money into home and community care so that the resources, the people, the PSWs, personal support workers, and nurses are encouraged to take that vocation and take care of our citizens at home if they choose to be taken care at home. We put money into in healthcare, for example, digitizing. There's so much to do and so many opportunities to make things more efficient in our healthcare system. So, for example, we're using artificial intelligence to take clinical notes from a meeting with your specialist or your physician. It's already being done in some hospitals. So effective, so efficient, accurate. So it's just not one thing in our healthcare system as we transform it. It's multiple things, and we're going to continue that. That's a journey.
That's interesting. I've always said that AI, there's always a lot of concern about AI in this or that field, but in healthcare, it's really part of the solution, isn't it?
It's really, really revolutionary in a way. And sure, we have to make sure we safeguard against the other elements of AI that can be not as good, but there's so much more positive. And let me give you another example how AI can mine data. We have so much data that using, obviously confidentially, privacy issues, security issues, all taken care of, but allows you to say the predictive analytics of what the chances are you might get bladder cancer, for example. What are the symptoms? Because we got decades worth of data, and being more preventative. It's a powerful tool. So let's embrace the best parts of it. And I think that's something that our government has embraced. In fact, I've been the champion of that since day one.
And so you see an expansion of that into the future?
Every budget, we're all, because using data, using artificial intelligence is a means to get better outcomes for patients, for citizens, for while safeguarding privacy and cybersecurity. But you can't just put your head in the sand and just hope it goes away. We got to embrace it. And I absolutely see that on so many levels. We see it in the private sector, and we see it now being used in Ontario in the public sector to get better outcomes for people on more efficient. And in fact, it's more value for the taxpayer. So it's a win-win-win.
We're going to continue with our guest, the Honorable Peter Bethlenfalvy, after these messages. Please stay with us.